Bismillahirrahmanirrahim. Welcome back to the DrSelim ECG channel. Today we'll continue ischemic heart disease workshop, quiz number 11 to 15. This quiz number 11, 51 years old, male, diabetic. He had typical chest pain for last 6 hours before presentation to ER. This is the ECG. Don't forget rhythm, rate, axis, sinus, not sinus, hypertrophy, ischemia, infarction, and arrhythmia. Don't forget these steps. We'll start with rhythm. Regular or irregular? This rhythm is irregular. This sinus beat and this abnormal, bizarre shape without B wave. So this BVCs by Gemini, mostly due to ischemia. This patient came with chest pain. So one sinus, one BVC is premature. Every other one so by Gemini. Patient has chest pain, so we must check for ST elevation, ST depression, vertical waves, ischemic changes. Here there is ST elevation where V1, V2, V3, V4 up to V6. In ST depression, yes, there is depression in lead 2, 3 with inverted T wave, also AVF. So there is depression in inferior leads, this is reciprocal change, and this elevation in V1 up to V6. So the diagnosis will be acute anteroceptal ischemia. Quiz number 12, 22 years old, Indian male, smoker. He had typical chest pain for last 4 days before presentation to you. What there is? Regular, sinus, BF within normal, BRH within normal, course duration within normal, but the abnormalities were, yes, abnormalities, there is abnormal Q, pathological Q, from V1, V2, V3, up to V4, and also V5, the very small R. So, poor R regression with loss of R wave, and there is biphasic, still biphasic T wave in chest leads. So the diagnosis will be old anteroceptal ischemia. Quiz number 13, 54 years old, male, smoker. He had typical chest pain for last 2 hours before presentation to ER. This is the ECG on arrival. Rhythm regular, but there is one premature here. What about sinus or not sinus? There is B wave here. See this B wave, yes, B wave in this part from ECG. But after the premature, there is no B wave. So this junction rhythm here and this sinus rhythm. So mostly due to ischemia. Patient has chest pain, and there is what is the changes here? Yes, elevation in V1, V2, V3 with Q wave till V6, from V1 up to V6. So the diagnosis will be acute extensive anterior ischemia. Clear. Quiz number 14, 48 years old, male, smoker. He had typical chest pain for last 2 hours before presentation to ER. This is the ECG. Rhythm regular, sinus, B wave within normal, BR interval, yes, little bit prolonged, more than 1 big square. This is first degree heart block due to ischemia. The patient has chest pain, and there are ST elevation 2, 3 AVF clear, and this depression lead 1 AVL. Also in V1 and V2 with prominent R wave. Don't forget, I told you, when you see inferior ischemia with ST depression in V2 or V3 or V1 prominent R wave, you must do posterior leads and right side leads. Why? To exclude posterior ischemia and right side infarction. So the diagnosis will be here acute inferior ischemia, and you must do posterior leads to exclude posterior STEMI also. Clear? Clear. Also with first degree heart block due to ischemia. Quiz number 15. 65 years old, the male smoker. He had the coronary angiography 6 months ago. He came to OPD for follow-up. This is ECG. Rhythm, regular, sinus, beauty with normal, abnormalities where, yeah, there are also pathological Q waves from V2 up to V5 out of progression, with still also little bit biphasic T wave. Also there is QF in let 3 VF. So the diagnosis will be the patient had coronary angio 6 months ago, old, angioceptal STEMI, also can be inferior STEMI, old inferior STEMI also. Clear? Clear. Thank you for watching. See you next video inshallah.